Hi, how are you?
Good. Welcome to the Violin Endoscopy Center.
Nice to see you, Jen. It's a pleasure. Jen, maybe you could tell me about all the things that have happened and what you do here.
So we perform endoscopic procedures, referred to a lot of times in the community as just endoscopies, both upper endoscopy or in short EGD and colonoscopies. And that's an exam that allows the physician to visualize the GI tract from the inside, taking images and any interventions that are necessary during the procedure. So we have a great group of providers here, both male and female gastroenterologists.
Right, that we can patient choice.
Patient choice for the increased level of comfort.
That's great. Well, I can't wait to see the place. Can you show me all the great stuff inside?
Sure, I would love to. I'm going to take you to the pre-op bays. They designed the building really beautifully. Yeah. Each bay is set up, we have 12 bays here. Each bay is set up the same. So when patients come in the morning, they're brought in by a nurse and we do a set of vital signs to obtain some history.
So Jen, tell me, who should have a colonoscopy and when?
Anybody over the age of 45 should have a routine baseline screening colonoscopy. And then for any patients between the ages of 45 to 75, we actually have a new initiative with Inspira that allows you to call a direct access scheduling number and schedule directly without even seeing one of the providers.
That's great. I can't wait to see the suite.
Can't wait to show you. It's a pleasure having you here, Amy.
Thank you so much, Jay. I appreciate it.
Now I want to hand you off to Dr. Kara DeJoseph, one of our gastroenterologists.
Hey, Dr. Joseph, nice to see you. Nice to meet you. Yeah. So, Dr. DeJoseph, I know that the big question is the prep. That's what frightens everybody. Could you just talk a little bit about it and how it might have changed over the years?
Yeah, so I think historically you just had to drink a big jug and it used to not be the most flavorful thing and the most appetizing thing. But in recent years, we've had an expansion of all the bowel preps that exist out there. And depending on what you and your physician decide on what bowel prep's best for you, it can range from pills, small amount of liquid, to still a large amount of liquid, but it's way more palatable and you can mix it with your favorite drinks at home.
Why should people be doing the colonoscopy?
Yeah, so colonoscopies are really great for both screening and diagnostic purposes. From a screening, it's the best test out there that we can both detect precancerous polyps that we know that over time can turn into cancer, but we can also remove them at the same time. So it's kind of two for the price of one, and it eases your mind and can prevent you from developing cancer, just determines when your scope is.
What are you doing while they're having their colonoscopy?
So we actually have one of our scopes right here.
Oh, okay.
So it is a really pretty simple procedure. What I tell patients is it's a long flexile tube with a little light and camera at the end of it. And we go in right through your bottom, all the way around your large intestine to where your large intestine meets your small intestine. And really during the procedure, I'm not really looking at your bottom, I'm looking at the screen right here. And when we insert it, we're really focusing on the screen itself. Looking at the screen, we can detect any tissue abnormalities or any polyps, and when we see any of those polyps, we can completely remove them so they do not have the potential to turn into cancer.
What is the most important thing you want patients to know?
So I just want patients to know really that colonoscopy should not be intimidating. I know it can be really daunting to deal with the bowel prep and to deal with something very sensitive as looking through your colon, but we take the precautions to make sure that you feel comfortable and safe during the procedure.
That's great. And so people can get their screening, they can get in here, we have direct access scheduling, all of those things have tried to make it easier for people just to come do it.